teaching today, we are going to concentrate on cardiogenic shock care. So, first, we have to know what cardiogenic shock is. It is a type of shock that occurs when the heart is unable to pump effectively due to cardiac factors. This causes inadequate tissue perfusion that impairs cellular function and can lead to organ failure. For etiology, the main cause of cardiogenic shock is due to MI. Other factors like medication can cause the heart to lose the ability to pump effectively. This reduces the amount of blood circulating in the body system. At the initial stage, the client will show signs of cyanosis of the skin, lips, and nails due to insufficient oxygen delivered to the body. As the disease progresses, there is a backward flow of blood that causes pulmonary edema and retention of blood in the right side of the heart, which increases right atrial pressure. Risk factors are advanced cardiac diseases and old age. These diseases can be prevented by living a heart-healthy life, which involve controlling blood pressure, not smoking, not drinking excessive amounts of alcohol, maintaining a good weight, reducing fatty food intake, and finding a good way to cope with stress. I have grouped the causes into three, and they all affect the heart's ability to pump effectively. The first group talk about diseases, and some of the diseases is MI. MI can be caused by hyperlipidemia, tobacco use, obesity, excessive alcohol intake, and other diseases is hypertension, heart failure, cardiomyopathy, which is the heart muscles diseases that make it harder for the heart to pump enough blood into the body, and it's caused by viral infection or inherited genes or alcohol intake. Other diseases is pulmonary embolism, cardiac tamponade, which is when fluid surround around the heart, and we have coronary diseases. This is when there is a restriction of blood flow to the heart. The second causes is valvular problem. It's when valves rupture or stenosis happen. This causes stiffness of the heart valves, which narrow the size of the valve opening and restrict blood flow into the system. The last group talk about electrical conduction, normally which is dysrhythmia. This happens when we have abnormal or irregular heartbeats. Some of the symptoms is increased left ventricular and diastolic pressure, distended jugular vein, intense fatigue, hypotension, dependent edema, restlessness, lethargy progressing to coma, oliguria to anuria, cold and sweaty toes and fingers, confusion, anxiety, chest pain, weak pulse, dizziness, elevated central venous pressure, pale skin, increased labored breathing, crackle, and wheezing. For lab and diagnostic tests, we will do ABJ, which will measure the balance of oxygen and carbon dioxide in the blood. We will also do B-type natriuretic peptide, which is the BNP. This will show elevation in response to increased left ventricular pressure. We will also do electrocardiogram. This will assess the heart rhythm changes associated with MI and dysrhythmia. Echocardiography also visualize or examine the heart for cardiomegaly and evaluate cardiac contractility and function. We will also do CT scan. This will check cardiomegaly, cardiac tamponade, pulmonary emboly, cardiac myopathy. We also do cardiac catheterization to identify coronary artery blockage. Chest X-ray is used to diagnose cardiomegaly or evaluate the lungs. Atrial line may be inserted for continuum blood pressure monitoring and blood draw. Pulmonary artery catheter may be inserted to measure CVP and PAWP, which the CVP is the central venous pressure and the PAWP is the pulmonary artery wedge pressure. This will help us to measure the pressure in the central venous and in the pulmonary artery. For treatments, because cardiogenic shock is caused by different stuff, we're going to do different things. So we will prepare clients for intubation and mechanical ventilation. We will administer oxygen as needed or prescribed. We will prepare clients for electrical shock. It can be cardioversion or defibrillation, normally which is used for dysrhythmia, arterial line insertion for hemodynamic monitoring. We will do coronary artery bypass graft. It is a surgery to create a new path for blood to flow to the heart due to narrowing or blocked artery. We will also do cardiac catheterization. It is a catheter insertion with a guided X-ray into the vessel to open blocked artery. A balloon at the tip of the catheter is inflated to help break plaque or clots. We also give medication like vasopressor, which example is dopamine hydrochloric or norepinephrine. They strengthen cardiac contractility and increase cardiac output. It increases kidney perfusion at low doses, but decreases kidney perfusion at high doses. Administered by continuous IV infusion with constant hemodynamic monitoring. Monitor urine output. Administer through a central line to prevent extravasation. We will also give inotropic agents like dobutamine. They strengthen cardiac contraction and increase cardiac output. So we have to check for headache and chest pain when giving this medication. We will also give opioid like morphine. We have to make sure we check in respiration with that and have naloxone and resuscitation equipment available for severe respiratory depression in a client who is non-ventilated. We also use anticoagulants for deep vein prophylaxis. This will help us to prevent deep vein thrombosis. We also do thrombolytic agent like alteplase, which will help us break up clots. We also use anti-dysrhythmia medication like adenosine and amiodarone. We have to watch out for bradycardia and hypotension when giving this medication. For nursing care, we have to ensure that the clients understand procedures and give informed consent. We have to prepare client for intubation and ventilation. We need resuscitation equipment in the room. We have to administer oxygen as needed or prescribed. Vital signs need to be monitored. We should ask for selfish or iodine allergy for contrast dye use for cardiac catheterization and ensure that clients remain NPO for 8 hours before the procedure. We shouldn't give metformin within 48 hours before cardiac catheterization. We have to report any signs of infection to the provider. We have to give medication to improve organ perfusion and reduce pain. We have to monitor ECG during catheter insertion and confirm placement using chest X-ray. We have to do continual hemodynamic monitoring. We have to help patients to get appropriate referral, like cardiac rehabilitation. Um, for complication, it can lead to death or organ failure. And what we need to teach our patient is to make sure they change position slowly to avoid dizziness, which can lead to fall. We have to teach them how to take their blood pressure and pause. We have to educate patients and family about diseases and encourage them to express feeling or concerns. We have to tell them to have adequate rest by reducing stimulation. We instruct patient and family of signs and symptoms to report, like chest pain, loss of consciousness, hypertension. We have to encourage our patients to stop smoking and limit alcohol intake. We have to encourage our patients to eat a heart healthy diet and exercise regularly. We have to advise our patients to use electrical shaving machine to prevent bleeding. We have to instruct patients to take medication as ordered. This will bring us to the end of our teaching.